this powerful tool the King County Resource Team has put together with regards to some of the resources or the essential resources that are available in the state of Washington, or King County specifically, with regards to financial assistance, healthcare, transportation, food, education, and housing. Obviously, there's quite a bit more. That's just to give you guys a rough idea of what exactly some of these services entail. As I mentioned before, as I introduced myself, I am Joel, a researcher here for PR, and our goal here is to again work with community members and community leaders to shed some light on what's available, recognizing that some of the barriers towards service utilization are ingrained in language barriers, and so some of our work is to uncover said language barriers and try and mediate against those by working in close communication with community leaders and ensuring that everyone is aware of what is available. And so that's why such a powerful tool by the Resource Access Team is really really crucial. To that note, we have two great guest speakers. We have Bruno and Spencer, who are going to walk us through this fantastic tool that we now have available to us. But before I leave them the floor, just gonna quickly rush through the agenda of what everyone should expect for the next few minutes. Obviously, you've just done the introduction session. We're going to dive into the self-service database, what exactly it is, an overview, eligibility criteria, and some navigation tips. I know it can be fairly overwhelming to have a lot of data at one's fingertips at once. With connecting with the resource team and required documents for appointments at any time you access any of the services that are available, and a Q&A section, and then finally just at the end, just sharing of relevant links for any interested parties. So hopefully I've kind of given everyone a rough idea, a skeleton of what the rest of the meeting is going to look like. And without further ado, either Spencer or Ferno, please go for it.
Yeah, so I'm going to have Spencer, Ferno's going to be bringing the PowerPoint up for us. But as she gets that ready, I will introduce myself again. I know I noticed some people, they just came on came into the meeting. So my name is Enedelia Nicholson, and I'm the Resource Access Outreach Manager. Our team is the Resource Access Team. Our department is the Department of Community and Human Services, and our division is the Adult Services Division. And so with that said, I will pass it on to our outreach specialists and have them introduce themselves, and then we will continue with our presentation.
Thank you. My name is Ferno West. I use she, her pronouns. I am one of the outreach specialists. I'll pass it to Spencer.
Hi there, everyone. My name's Spencer Sherman. I use he, him pronouns and am another one of the outreach specialists of the newly formed Resource Access Team. Great to be here today. So just to give everyone a little bit more background on our team, who we are, what we do. We are the Resource Access Team. We are funded by the Veterans, Seniors, and Human Services Levy. That funding recently got renewed in 2024, and we're going to be running through 5 years through 2029. Our position is one of acting as a liaison for the many, many resources that we have to assist people in King County. So while we don't provide a lot of those services ourselves, we do provide some emergency financial assistance that we're going to go over later in the presentation. Our main goal is trying to connect people with the services they need and take the barriers out of the way so it's easy for them to do that. Ferno, could I get you to go to next slide, please? Now, in terms of our rationale, I think it's really important to understand who we're focused predominantly on serving, where we provide those services, and how we do it. So we, as the name of our levy suggests, we are focused on assisting our veterans, seniors. Sorry, got a dog in here who really wants to, be part of the presentation right now. We are focused on veterans, seniors, and our resilient populations, like our unhoused population here in King County. And while we understand all those groups need assistance, we're also aware of the fact that out in the rural and unincorporated areas of King County, these services are harder to access. So we're going to put a special focus on trying to make sure we reach these areas, both by having remote ways to access our services and also by having staff like myself and Furno directly go out to these areas to raise kind of awareness of our program here. Now, the way we provide services is predominantly through a call center or online chat function, and just kind of a focus on us helping reduce either language barriers or other cultural barriers to make sure people are more easily able to access those resources. And just kind of last thing I want to hit on before I pass it on to Furno here is that we are also going to be kind of networking with those other CBOs to provide resource fairs. Our goal is over the next 5 years to hit all 9 districts of King County. And I'm going to pass it on to Furno here to tell you a little bit more about our team.
Yeah, Resource Access team has 3 wonderful teams. We have the outreach team, which is the entry point. We have the agents, where they will be in the call center, and then we also have navigators. The outreach team, such as Spencer and I, we're going to be in the King County areas, supporting residents, just setting up different outreach tabling and like in the library and CBOs in different places. We also plan to establish relationship with community-based organization, provide different outreach strategies, presentation like this one, and work on like workshop. Would love to also be at different community resource fairs, just participate in those. And we also plan to organize community resource fairs in all the 9 districts. We'll have iPads to support with like collecting feedback and how like the community wants to see what resources working and what's not. And then also we'll have those iPads to support residents, connect them to our call centers, via chats, or just provide them a number to call. So we'll be out in the communities, just like, working with different CBOs and just being out in the community working with outreach. We also have the resource agents. The agents are going to be where the call center is. They will take the calls or chat function that we have, and they will help residents find the resources that they need, just work on finding a good one that works for them. They will do arm transfer as well if needed to different resources. And then we have in-person appointments as well, currently limited, that they, if they make appointments, they can meet with our agents in our Tukwila office. Our primary language currently is English and Spanish. And however, our staff do speak various languages. The other team is navigators. Navigators are where residents connect to upon referrals. They, if the agent is not able to find the resources that they need, or that person does need a financial assistant, that's how they get connected to our navigators. They are the team that's going to assess the financial needs and provide financial assistance, and also work with the resident to work on a plan. They are also able to meet customers in community. So a client or applicant is not able to come to our office, or there is a barrier, they will meet residents and communities such as libraries and common spaces there. So that's where our team is going to be. All the three team work together to really just make it more accessible from the outreach to the navigators all the way. Go ahead, Spencer.
Perfect. Thank you for that, Furno. So as I stated earlier, while we don't provide direct services ourselves outside of some limited financial assistance, we're here to connect people with all the resources that social services in King County have to offer. So obviously there's a wealth of those resources listed on your screen. I don't want to inundate you too much. The main thing I want to get across to you here is that we can assist with kind of all the usual or unusual things that, you know, the people you're working with might need, whether it's an unhoused person who just needs help finding a shower or hygiene items, whether it is a veteran looking for what benefits they might qualify for, we can direct them to the right place there. Someone who needs utility or rental assistance, we can get them connected with one of the many rental assistance outlets that exist within King County, or those more acute areas like instances of mental health crisis or domestic violence. We can kind of serve those more acute needs as well. And I'm just going to go ahead and see a question there. We'll get to that as soon as we're finished here. And I'm going to pass it on to Furno to tell you a little bit more about how you can connect with us.
Yeah, so here's how residents can connect with the resource access team. We do have this phone number that directly connect them to our call center, which are the agents. And then we also do have a chat function where folks can chat with our agents. And then lastly, we do have some in-person appointment, like I said earlier. So by calling and making those appointments, you can meet with agents and if necessary with our navigators as well, but if the agents refer them to that service there. Our website I'm gonna navigate to is pretty useful and resourceful. So when you go into that by scanning the QR code or the link we can drop in the chat in a moment, will take you here. This is the resource access team website. It's got information on like what we provide and what we don't provide. The chat function here on the right, if you happen to not see it, you can see the little bubble on the right there. If you click on it, so you can chat with agents here and they will be able to support you with the services that you need. If they're not able to, they will refer you to our navigators. So it looks like if you scroll down all the way here, we do have a self-serve resource database. So if you happen to not be able to call the office or chat, or you just don't want to interact with anyone at the moment, you can find the resources. I see this being really useful for CBOs, community-based organizations, just finding different resources, whatever that may be. Could be on a weekend by inputting all of like 98026. These two information can find different resources that is accessible in the area for the community. So that's really useful. And I'll leave it at that. And these are all different resources we can support. This database does have. Some of Spencer has mentioned. If you scroll down, we'll also have the financial assistant information there. What we'll cover in a little bit, what's required to be eligible, what we serve, what's required, and then also what we will not cover and what we will cover as well. So this is kind of what it looks like. you can kind of bookmark it, or we'll drop the link in a moment, or maybe at the end of our presentation. We'll go back to this. See, yeah, so you can find that information there. If you have any question around our website, also you can reach out to us.
Great. Now, as many of you, I'm sure, keyed in on earlier, we do provide some emergency financial assistance as one of the areas of direct support that we can provide to the community. Now, I want to caveat this by saying that we do not provide actual rental assistance, though we can connect with a number of different CBOs like HopeLink or United Way that do provide those services. So even if you need rental assistance, though we don't directly provide it, please still feel free to reach out to one of our agents so that we can kind of assess the needs, see where best to get you, see whether we're someone who's going to provide that financial assistance or whether we need to refer that to the correct organization to make sure that that person gets help. The things we do provide assistance for, as you can see, are employment, education goals, and basic needs, though those things have a lot of stretch to them. Like, as I'm sure many of us are aware, a cell phone, is pretty necessary for most job searches nowadays. So that can fall under employment, and different one-time emergent needs kind of do need to be focused and handled on a case-by-case basis. So I just reiterate here, when in doubt, please call in so that we can help be another partner in solving that situation and find the right resources for you here. We are meant for one-time emergent needs, and not recurring needs as another thing to think about. So if something is more of a recurrent need, there's a likelihood that we're going to have to find an outside resource in order to assist you there. Ferno, if I could get you to go to the next slide, please. Now, we just have a couple things here regarding our eligibility. Well, I know a list of 8 might look like a lot. Many of these are fairly low barrier things that we are happy to help make sure people get to in order to qualify here. But the things that we need in order to be eligible for our financial assistance are to be 18 years or older or an emancipated minor, because we are part of the Adult Services Division. Proof they need to reside within one of King County's 9 districts, provide proof of identity, residency, their need, and their current income. And at that point, if our agents have deemed it appropriate, they'll get referred and meet with one of our navigators who will enroll them in navigation services and help them develop that financial crisis mitigation plan to ensure that this is a one-off expense where we can help solve the problem as opposed to kind of more of a recurrent need here.
Thank you, Spencer. So here's our call center hours. So we're open from Monday to Friday, 9 to 4, except Wednesdays. We will be only open from 1 to 4. And then we're closed on the weekend. So this is a time where residents can call the call center, chat, and just make appointments as well. So this would be the time. And if CBOs are open on weekends and do need that type of services, the self-serve database is really handy there to find any emergency resources, like finding shelters and things like that. But these are the hours of our operation. And then our contact information, we're coming toward the ends here. So we'd love to work with different CBOs that are serving our communities. So if you want to get in touch with us, here is our email, phone number. Spencer and I are going to be out in the communities, participating in different resource fairs and hosting at a library and different CBOs. So you can reach us with this information if you have any questions or want to work together. And now we can open the floor to any questions you may have. We'll be happy to answer. Feel free to unmute. If there is a question in the chat, I can't see it, so someone wants to read it.
Thank you, Spencer, for that. I'm just going to jump in and say thank you, and Spencer and Ferno for the presentation. Yeah, and like Ferno said, this is the time for you guys to ask questions. I think I saw, will we receive the PowerPoint? Right now, currently, all the information is basically on the website. So we just pulled that information and put it into this PowerPoint. We're not necessarily, this PowerPoint is just for us to kind of help us guide the conversation and present our program. So we're not, necessarily sharing it because it's just bullet points. And so to remind us of what we need to share with you guys. And so, but there's more detail and information in our website. And I can ask Ferno to bring our website up. I'm going to, Ferno, can you bring our website up just so I can go through it with you guys a little bit? And then talk about, I think one of the questions was our database. And so I just do want to make sure, and then Ferno, can you make the chat kind of go away really quickly for me, please? Go ahead and bring it up. And so from the top, so yeah, so our information's here, and our database, we actually worked with 211. I don't know if you guys are familiar with 211. So our database, we collaborated with 211, and so our database was modeled after them. And I think in the website, it kind of talks a little bit about that. Can you scroll down a little bit, Ferno? Let's see, I think, yeah. So the Resource Access Team Self-Service Online Database was created in partnership with 211. 211 is a line, and it's a statewide line where, community can call in and get connected to various services. And so this, if this database looks familiar to you guys, that's the reason why it does. And so, and another reason too, like we are a very new team. And so when we launched our services September 30th. And so our hours were from 10 to 3. And so we just currently updated our hours from 9 to 4. And so, as we move through our services and roll out our program, we continually update our website to provide that information. Any questions?
I just dropped the link in the chat as well, so you are able to open them if you want to, so that you can kind of have that for yourself.
Okay, somebody asked a question. Are these resources only for recent immigrants or for anybody in there? No, these resources, so we're our job is to connect King County residents to resources. So we don't necessarily provide any type of resources. We did mention the emergency financial assistance, but that's more of a emergent need, not necessarily like a resource. So our job is to connect residents, King County residents, to providers and to services. And so, that's, I think, before we began the presentation, I was asking how the people who are in this presentation, are you guys providers? How do you guys, what type of social services do you guys provide to, I think when we first introduced ourselves to come and present, I think the focus is it immigrants and refugees? Is that correct? And so someone can jump in and answer that question. But no, this is for everyone who lives in King County, who Our call center is, anybody can call our call center and we will refer them. But the emergency funding, because we are part of the Veterans, Senior, and Human Services Levy, the emergency funding, you do have to be 18 years or older or emancipated minor. Did that answer your question in regards to immigrants?
Yes.
Okay.
Thank you.
Mm-hmm.
There is another question. Who provides then services like educational services, preparation for employment? It's very big projects.
Oh, no, we don't provide, preparation for employment. What we in that section, we were talking about financial assistance. So in that slide, it talked about we provide assistance to, if someone needs to continue with their employment. So for example, maybe somebody needs to update their license, and at that moment they don't have, let's say their CDL license, right? Or they don't have the funding to do it, maybe that's a barrier for them and it's an emergent need, then we can do that. But we don't provide, employment services. We provide financial assistance to, make sure that it leads to employment or maybe to, keep you employed.
So as far as I know, there are limited resources for those who would like to learn the language. In colleges, for example, there is a line, or how to say, they need to a waiting list, sometimes half a year. And the classes are oversized and do not provide necessary preparation for employment. They teach grammar. There are no classes for beginners. Are there any resources that are completely for educational and language services that the English teachers could be hired as a not only on a contract basis, but have some real employment also? And interpreters, they are like gig workers themselves.
We are not an employment agency, and so we don't provide employment, those type of services for like ESL instruction. So our job is to connect King County residents to providers and services. So we don't provide any type of employment services for ESL instructors.
But
I hope I'm
this is,
answering the
yes, yeah, but this is the problem. There are not enough resources. There are a lot of people who provide connection to resources, but how can we create these resources together?
Yeah,
maybe,
thank you. Yeah,
yeah.
thank you. Yeah, thank you for that question. Yeah, it's definitely that's definitely, thank you for bringing that up. I think that conversation, would probably have to partner up with, a different in a different setting, because that's not the work that we do. And so, but I definitely hear what you're saying. I myself was an ESL instructor, and I actually worked for Bellevue College, and I've been, I worked in the community colleges umbrella for many years.
Yes.
And so, I in regards to providing and working in the adults program for ESL. So I definitely hear what you're saying in regards to classes and all that, because I was part of that. But for this purpose and for this presentation, yeah, our job is, is the resource access team to connect service, help residents to connect them to those services. So if we do have, an individual who's looking for ESL, classes, it is our agent's job to, figure out who provides those type of services. Like you mentioned, community colleges, like I think there's 32 community colleges, they provide those type of services. They have evening and evening and nighttime. And I know local libraries also provide that, but it is our agents' job to kind of help do that research for them and hopefully connecting them to a type of class that they.
Yeah. Maybe if Sean knows how to create this, because there should be a pool of people who can provide this education and services.
Absolutely. Larissa, we would like to chat. I think, the link was shared probably through Tamara. We can catch up and probably, team up and see how can we just really make a collation of kind of a consortium to be able to provide this type of services. There is so much need.
Yes.
We launched a research study about especially Afghan immigrants. Now we're working on Ukrainian, Congolese, and some of the African descent immigrants. And so there is so much happening in the communities. We would love to chat about it. And I'm glad that we got the chance to connect with the Anidelia team and also Spencer and Furno. Amazing work. I have just two questions, because this recording goes back to the community leaders, and we have some of the community leaders here who are really dealing with kind of a really day-to-day needs of the community members. The first thing is, could you kindly elaborate more on the kind of employment emergency fund, because there is so much happening within the community that they want to really kick off things, and they need little support for transportation, document validation, evaluation, and even sometimes they can't really afford to pay rent, and also some to apply for some sort of training, there are certification programs that they want to get to be able to get into the job market. If you could elaborate on that, that would be fantastic. That's one question. The second is how do you guys work with the providers? Do we have a partnership? How does the referral system works within your collaboration with other institutions? Do you have official basically collaboration with them, and when the clients get referred to them, how probable it is to get the services that they need? Because the reason I ask this question, because from December on, we will be working in the community. My team and I, we will have an actual project actually running in the community, basically bringing the needs of the community to the providers. So they will have staff fully in the community every day. They speak different languages. That's what's going to happen from December on. And I think this kind of information, if you could provide, would really help our team and so many other providers, so many other community leaders here to understand how can they really channel and what to expect if they refer their community members to you guys.
Yeah, thank you for that. You froze. I don't know if it happened only to me or other people. I did hear your first question in regards to speaking. So our funding is the emergency funding assistance. So it's an emergency need.
You froze, Anidelia.
Yeah, I think I can't. Maybe for no Spencer, go ahead until Anidelia is back.
Sure. Anidelia, can you hear us? So yeah, it's only emergencies. So if someone could be having employment emergencies, right? Let's say to get to their employment or to be able to keep their employment, there is a specific task that they have to do, right? It could be transportation. It could be some of the example was given some things that we can't hear you, Anidelia, sorry. So Spencer, feel free to jump in. I think like if someone is trying to get to their work or be able to keep their work, you know, and any emergency assistance around that, we will be able to cover. Again, that would be based on the eligibility. Do you want to go ahead and give it a shot, Anadelia? Can you? Oh, you're muted now.
Yeah, you're
Yeah, now I'm muted.
Yeah, go ahead.
I like, oh, I got frozen. So I believe, Ferno, did you take on that question in regards to just being, our funding is emergency financial assistance, so it's an emergent need. And so, you know, we do look at, you know, the navigators would, you know, do an intake and talk to the individual and kind of make that decision of like, you know, how the, you know, their emergent need and helping, you know, close that gap. So for example, you know, like I said, gave the example of someone who, you know, is needs to renew their license and they don't have the funds available, you know, to renew their license for employment, then that's an emergent need that we can cover. So, and it's a limited financial, you know, funding that we have. So it's not funding that, you know, we have, you know, it's a limited funding that we have. So when we are looking at people's needs and looking at like, you know, their emergency need, that's why it's very important for them to meet with our navigators so they can kind of, you know, either help them find a provider that's able to help them. And if, you know, in that case for employment, if we can't find somebody, then we definitely will, you know, cover that cost. I'm not muted, right? Okay. Does that answer your question?
Yeah,
Yes,
I
sir.
think that's a great information, a piece of information that's helpful. You know, within the communities, like there are members of the community who are applying for CDL. There are so many professional immigrants, like, you know, that we work with. They would love to pass a kind of a certification program, but they are not really able to pay for that. These type of needs are really kind of, I would say, it is at a enormous level, I can say. Yeah, my second question was about like, you know, your partnership and collaboration with other providers. How do you guys work together? Like basically, do you have an official collaboration? How the referral system work? Like once, just imagine from December on, we will bring on board so many other clients who are really in need, and we would really reach out to you to connect us to the providers. How much is the probability of them getting the services that they need, like, you know, for employment, housing, and like, you know, healthcare, food and shelter, how rental assistance, stuff like that.
Yeah, so like I said, our database system is modeled through the 211. So providers throughout the Washington state, you know, submit their, if they want to be part of the 211, you know, part of that system, then they submit like an application, and then that's how they appear into the system. Our system is connected to that. We don't intersect, but we get that information through them. And so that's why when you use a database, you will see all that information, because providers do, you know, who want to be part of the system provide that information. However, let's say we don't have a provider that offers services and they're not in the database system, we will have a system in place for them to put that information so that we have it on our end to be able to help. We do the VSHLS levy funds numerous providers. So we do collaborate with providers. Just recently, we had a summit for providers that are partners with our program. And so that's how we also work with providers in the community as well. So yeah, that So that's how we're working. So yeah, like again, like for Spencer, if they're out in community and they meet with a provider that might not be in our system, we will make sure that we are able to move them into our system. But our job, I want to emphasize, like our job is connecting our King County residents to providers and to services. So that's our primary role. We're connecting them. So for example, like, if they need housing, we don't provide housing assistance, but, we will connect them to different providers in hopes that they might have, some, assistance. But, and I think somebody mentioned there's a huge need, right? So sometimes there's providers who already exhausted their funding, and so it's our job to kind of figure out, okay, this provider exhausted their funding, who's next on the list? Like, who do we have, right? And it's doing that legwork for the community members.
Fantastic. Thank you.
Mhm.
Thank you so much, Natalia. We have Mohammed. Mohammed, could you please go ahead and introduce yourself and
Thank you,
ask your
Hassan.
question? Yeah, good to see you.
Thank you. I really I felt really happy because there is like resilient communities get some kind of like additional support here with this wonderful team, and I love this kind of model where like people who are from the same communities supporting their communities. I appreciate that. As Hassan said, there are like some kind of like needs in our communities that are not really met by the system, you know. Um, and honestly, like most of our communities, refugees and immigrants, especially new arriving families, are in constant emergency situation because they are in need of like essential basic support. For example, Hassan said about CDL, and honestly, like there is before that, even like some our many of our community members like have a huge challenge when it comes to driver license, just like normal driver license, like knowledge test, practical test. These are like a huge expense for like a new arriving family who have nothing to and have no connections, no extended families, no big kind of like support within the communities. So I would love to see if there is a way that we like the team can focus on gaps within the system, on things that are not met within the community. There is like very rare resources that can meet these kind of needs in our communities. And I, like I am hopeful that this team can make really kind of like adjustments and things that, consider these kind of gaps as emergencies for our refugees and immigrants within like the first like 90 days, within the first let's say 6 months or one like first year. For example, women in our communities have a huge challenge when it comes to driving, and there is a big need because our families are like minimum 3, 4, 5 kids, and dads are like working like minimum wage and need like the support from moms also. The culture in our country makes it more challenging for like women to know driving, and here there's a need to push like some families and support them equitably, but there is no funding to these kind of needs. That's why I call these kind of things as gaps, and I would love to see if the team can meet some kind of these needs in a way. Thank you.
Thank you for that. I hope and help me, correct me if I'm pronouncing your name, Ehsan, correctly?
Mohammed.
My name is Mohammed. Yeah.
Oh no,
Ehsan
yeah,
is,
Mohammed.
my
No, I
friend here.
meant
Yeah.
I was talking Ehsan. Is that, am I pronouncing your name
Yes,
correctly?
absolutely.
Okay,
Yeah.
perfect. And so I want to, I know that you're recording and that you say you were going to share the recording. If you don't mind sharing it with, with us as well. So this way, Mohammed, him providing this feedback, is one of the things that we're going to be doing is like listening sessions too. I think Isan reached out to Marjan. Marjan is our manager that works with refugee and immigrant communities. And so I would love to, connect with her and say, this is some of the questions that we received. And so, and kind of building that relationship and collaboration and how we can better support this community. But yeah, Marjan is the person that does work with immigrants and refugee communities. We do as well. We, like our job is to provide, connect everyone that lives in King County to resources and providers. But I think, like this important question that you just brought up, I think I would like to share with Marjan and kind of get some feedback from her and like, have this type of conversations and collaborations to, because it is, as you mentioned, there's probably more than this, a need, there's probably more need as well. So I appreciate that. Thank you for that. And so the people on this team, are you guys social service providers? Do you guys provide any type of services to communities, to
There are some, like Muhammad's institutions. I think they
Okay.
provide direct services. There are, I think, other leaders as well. I see Khorrami, from HCWA. I think they provide direct services to the community. But honestly, some of these community-based organizations who are, I would say, the champions, they are the heavy lifters. They are doing the heavy lifting, like, with almost no funding. And I would say they are the champion, and they're doing really the real work in the community. I remember when I came as an immigrant in the United States, I saw many of my family members and friends who came here. If the communities were not there, these community-based organizations, probably they were not able to really kind of make it to the next level. So yeah, I think we have some of the community leaders here. Khorrami is here. Khorrami, could you please just unmute yourself and talk a little bit about, like, the type of services that you guys provide? And Muhammad, please feel free to share.
So, do we have time for some comment? Can you hear me?
Yeah.
So I have some positive experience in Tennessee when I was the director of ESL program and coordinator, and we created coalition among community colleges, but also adult education, which was separate from colleges, or literacy programs, and created volunteers groups. So because everyone has unique needs, and people who cannot even read or write in their language, for some languages, for some cultures, it can be more oral tradition or beginner level of English. Other programs that exist now could not satisfy their needs. So can we create some kind of a different way, maybe support ESL teachers who are looking for employment, but funded and paid by DHSS, and to have this money goes to people who provide services. For now, some non-for-profit organizations get money from grants, but then they hire volunteers. And as a result, teachers themselves and interpreters, they are themselves in the population of low income who cannot afford to live and also go to the food bank. Even they are essential workers. So how can we help people who help others?
Yeah, I think that's a question I think we have to really have a kind of a long conversation and collaboration. I'm glad that we made this conversation possible, and from now on, I think there is so much avenue we can start chatting with Marjan. I know Marjan. I have had the chance to work with Marjan on kind of a different initiatives, collaborated with King County. So hopefully we can connect sometime in the future. We can talk and see what are the opportunities to really scale some of the initiatives that you guys are running, and hopefully we get some sort of community collaborators involved in a more grounded initiative that is really needed in the community. As you can see, like the number of new arrivals, or I would say the new communities, our new communities in Washington State, especially in the King County area, it's really a big number. It's really a big number. It is a major part of our demographics now. That's good to be really brought to the attention of the decision makers and the senior officials to really include them in some sort of conversation and discussion, and to hear their perspective about some of the facts and things going on in the communities. I think we are almost almost 11, so we have just 2 minutes or 1 minute. I want to take this opportunity to thank you, Nidalia, Furno, and Spencer. Really amazing work. Thank you so much. Really appreciate the work you guys are doing. And I thank community leaders and amazing Larissa with a very amazing perspective. We would love to continue talking to you, Larissa. There's so much to share. We appreciate this collaboration, and I hope we can continue this conversation and collaboration. And I'm sure things would turn out different if we work together.
Yes, I thank you so much for inviting us to present. We love to, I don't know if you have people's contact information, to share with us after you, share the recording as well, because I would like to, talk to Marjan, and I think there was great questions, especially if you guys are going to be providing, going out to the community as well, because we'll be doing that as well. So I'd like to, share our flyer with you guys, so you guys can share it with community, and also, so they can have the information and our contact information, eligibility requirements, and so thank you so much, and I appreciate all your time, and I look forward to collaborating with all of you guys in the future.
Fantastic. Same here. Thank you so much. Really appreciate you guys. You have a great day. Take care. Bye.
Thank you. Bye.
Thank you all. Goodbye.